We have an hour scheduled for health, housing, and human services. So about 50% of that in presentation or less, that's fine. And then 50% in questions. And I know you've already been sent some questions in advance, and we saw some of the responses to that. So I'm sure they'll be in your comments. And this group has been having a number of questions of all the different departments. So I would say just expect that. So with that, I'm going to turn it over to Richard Swift. Thank you, Richard.
Chair Parks, how are you? It's really nice to see you. It's been a while.
Hey, yeah, it has been. Good to see you too.
So what I'll do is, I'm not sure about process here, if folks want to go through introductions or if you just want me to dive in.
Just dive in.
Okay, and so what I'll do, because I know you all are behind, I was tracking the conversation this morning. I will go through my presentation, I think, fairly quickly. What I'd like to do then is walk through the questions we received and answer those. I'm fine, being stopped with questions as I go through the materials, and then we can have some conversations about the overall budget, because having just listened to the conversation, I know there are a number of
questions. Yeah, and actually, we'd like you to do your presentation, and then we'll ask questions. And Brenda Howlett is watching the hands up on the screen, so folks will be doing that electronically, and then we'll get to those once you complete your presentation.
Okay. Well, for a large budget like H3S, the presentation you have here of I think 11 slides is fairly truncated down. So what you have in the first slide is, and we'll skip to there we go, the two pies. What you have right there are a visual representation of our revenues and expenditures. We are down, in our revenues, and expenditures we're keeping primarily flat. We're trying to keep those primarily flat. The next slide, you'll see to the right, essentially those curves there that sort of show where we are in terms of our operating revenues, our operating expenses, proposed end balance, which is down, and I'll talk more about that in a little bit, and then our general fund, which has remained largely flat. Probably in this, the biggest piece here to note is actually what I talked about, which is our proposed end balances. Those are the areas where H3S has addressed funding issues by using our fund balances to backfill. For example, my office, the director's office, I've made it a point to keep a certain amount of dollars in the director's office that are flexible, so that I can react to issues and challenges that any one of my divisions have faced. And I could go through a listing over the last, I think the first budget presentation I did for the county was I think it was the FY15 budget. It's hard to believe it was that long ago, but anyway, where I've then in subsequent years addressed issues for the divisions. That'll be one of the challenges going forward. I no longer have that. Probably actually the bulk of what sits now in what we consider fund balance, contingency, or reserve is with the health centers. That's about approximately right now $11 million. So I think going on to the next page then, and I think also to address, because I know that there's been, in listening this morning, some conversations about FTE. Our adopted budget for FY20 was at 575. The amended budget was 577. We, in our proposed budget this year, are at 581. It's important to note that related to FTE, this is a plan. This is, in the best of all possible worlds, we would hope to be able to have a fully employed FTE base of 581 positions for FY21. I do not expect to get there. and for a multitude of reasons. We have always been in a process of turnover. People leave, we rehire, people leave, we rehire. We've been participating in the exception process that Gary highlighted this morning. And the majority of our positions that we have gone out to hire on have been revenue producing positions, the majority of those being within the health centers. I can think of one general fund based position or partially based position that is, I wouldn't consider it new, but it's a reformulation of Sarah Present's position. She's our public health officer, medical director for the county. I believe a number of people are familiar with Sarah related to COVID-19 and the work she's been doing there. We had a structure with the other two counties where we essentially were sharing, and because of the need of the county, we reformatted that position, and now that's part of H3S as a formal position. So going through these slides quickly, what you have here is a summary of the different costs and the funds in summary of the health centers, of what I refer to as DOT, the Director's Office Team Health H3S Administration. Below that, Behavioral Health Division. Within my office, 9 FTE. Within Behavioral Health, you have 80 FTE approximately. Children, Family, and Community Services, you've got approximately 31 FTE there. Health centers, you're looking at 244 FTE. That is the bulk of H3S right there. And also the health centers are the bulk of, I would say, they occupy a large percentage of our overall expenses and revenue for the department. On to CD, which is a small unit, 9.6, but I'm proud of CD in the sense that you have a small unit there that actually produces an enormous amount of outcome for the county. I think over the last 11 years, community development has been responsible for the development of about, through its CDBG and home fund usages, actually about 12 years, close to 8,000 units of housing in the county. So when you think about 9.6 FTE, H3S gets a big bang for that. On to the next is public health, coming in at 56, almost 57 FTE. They've remained also on FTE fairly flat. And the expenses there and how that breaks out across that fund within different programs that make public health. I want to stop here and acknowledge the work that public health has been doing in response to COVID-19. I think at this point, the only thing that is largely COVID-19 free is this budget. We did this budget and the development of this back before we knew that this pandemic was going to hit, or we were getting the first inklings of it. And so we, by and large, do not have a whole lot of COVID-19 present in terms of our budget plan. On the social services, where you have approximately 148, almost 149 FTE, the bulk of that is sitting in the intellectual and developmental disabilities program. I'll talk more about that because within that program lie some of my concerns for state budget impacts and also for behavioral health in terms of their budget impacts. So then you have below that the summary of for each of the funds, their overall budgets, and then also, increases and decreases. And what you're seeing in terms of the general fund, which as Ken noted, is about 8%, maybe a little less of the county's overall general fund. And for H3S, in terms of general fund support, we are actually, I think, going to probably wind up either at 7% or a little bit below in terms of total general fund support for the department. And so our reductions are about almost 12% in terms of our general fund. So moving on, and I'll jump in, and now we're moving into our strategic results. What you have here are a couple slides that tie directly back to 3 slides that tie directly to the strategic priorities that the board has established. And so for affordable housing, and this is including an overall count for rehab units, and then also units that are in various stages of construction. So by 2025, you'll have 1,500 affordable housing units in development or will have been developed. And so I think by 2025, the majority will have been developed. H3S is directly responsible for 800 of those, approximately, and then what you have are an additional 700 that I would say are a shared effort between DTT and other departments in the county. And I think the emphasis here is to understand that these household and these development of these units is really focused on, for H3S, on that sector of the economy that is 0 to 60 in terms of average median income. And our work with DDT is more of a focus on 60% to 110% of average area median income. And we are specifically targeting for H3S that 0 to 30% in terms of AMI. These are the hardest individuals to house and also the hardest individuals to keep housed. It's extremely expensive to have people rotating in and out of housing. And so we are expanding our focus in terms of permanent supportive housing and the services related to that. Across that, where you have FY19 actual for affordable units completed and are rehabbed 44. The 20 target was 100. We're projected at this point to perform 128, and then the FY21 target is 200. Number of affordable units under construction across those years, 256, 100, 212. Those fluctuations are really about units in development, units completed. The 212 for us in FY20 is that PEDCOR construction on Audi Road. You can see it from 205 as you go past. Is 212 units. That's a project that we've done in coordination with PEDCOR out of Carmel, Indiana. A very positive project for the county. This is locking in 60% average median income across all of those units, and that lock-in is for 60 years. So it's a fair amount of subsidy that went into this up front, because that lock-in of subsidy for a 60-year period is extremely expensive to do and to maintain. And then below that, a number for affordable units in pre-development, you've got 200, 100, 100, and 200. I don't have any issues with the FY21 projected targets for us. In some ways, maybe we might exceed those. I do expect to essentially or potentially exceed those targets in FY22, as some of the projects that we have that looks like are going to come through on the Metro bond are slated to come through. We could potentially have as much as $80 million in unit development coming out of the Metro bond in the next couple of years. So then on to the next, let's see, reduce chronic and youth homelessness. There was a question that I'll read later, but it touched upon our CD program, the youth houselessness pilot project that we received money from, that is going to affect this particular measure, because this is an expanding problem for us in terms of our capacity to reduce chronic and youth homelessness in the county. By 2023, 30% of reduction of chronically homeless people and 30% reduction in homeless children and youth in the coordinated housing access list. There are some challenges in this work because when you look at the CHA, when you look at the coordinated housing access list, sorry about the acronyms, government's filled with them. This here is not necessarily what I consider an accurate representation of, in particular, houseless youth. Our counts and what we see in terms of talking with our school districts, 10 school districts across the county, this is probably more like actually about 800, 900 individuals. So within this measure, there are approximately 450 individuals on the CHA. That's not children, that's adults and families who are considered chronically homeless. About 90 on the wait list are under the age of 25. We're working on more detailed strategies regarding how to get those counts and do those better. The county has used its point in time count. I think I've talked with about this with the board before, that the point in time count is a snapshot. It is not necessarily something we consider to be an accurate count. But related to FY19, it's the actual percent of houseless individuals served by the Continuum care programs who move to or maintain stable housing, 85%. The FY20 target is 85%. As I said, we are adjusting and looking at some more detailed strategies, trying to also roll in strategies from our new money for the youth. So it's not applicable at this point, but we will have that going forward. And then the 21 target is still at 85%. We may adjust that based on some of the strategies we were able to develop. Percentage of houseless who have maintained or retained permanent housing 6 months after program completion. FY19, I'm happy to report 92%. The target is 65% for FY20. Again, we're redoing our strategies, and so we're going to retain within this measure our target of FY21 at 65%, but I do expect that to change. So then rolling forward from there. Thank you, Ed. Reducing domestic violence. COVID-19, we have seen an increase in this. We have a robust partnership with the district attorney's office. John's been a great partner in this, and also with the sheriff's office and our joint work with the Family Justice Center. But by 2024, 8% of our victims of domestic violence will not experience further abuse following their initial report. As I said, we have a robust partnership, but ACRES, we're tracking, related performance in this area, percent of clients with a domestic violence safety plan or increased knowledge of resources. In FY19, that was 93%. In 20, we hit 95%. We're projected right now at FY20 at 92%. I think that with COVID-19, that's probably going to drop. We will maintain our target for FY21 of 95%. And then moving forward to Title IX. So briefly, some of the accomplishments of the department. Children, Family and Community Connections, that's what CFCC stands for. In terms of workforce, has helped 254 participants find jobs with a 90-day job retention rate of 75%. What we find there is if people can hold that job for 90 days, the chance that they're going to continue on past that in terms of retention of that employment is high. Provided the weatherization within that same program, 64 low-income households receive weatherization. Public health, external relation partnerships and relationships to reduce the burden of infectious disease through the creation of the Clackamas County Sexual and Reproductive Health Task Force. I think part of that outcome and that work there was seeing Oregon City School District for the first time adopt within our school-based health centers family planning in terms of access for the kids within the health centers to reproductive education and supports related to safety in that space. Behavioral health, I'm going to skip the blueprint there, and what I'll do in sake of time, just go ahead and sort of move through these. Behavioral health has moved into a new space with Health Share of Oregon in terms of negotiating that contract as it affects our safety net and peer delivered services. We have fairly stable funding in that, although I think with COVID-19 and some of the effects for the state, we may see some changes. And then social services, more than 1,200 individuals experiencing houselessness were provided housing and comprehensive services. As I talked about in the previous measure, 92% retained housing for 6 months after the program exit. Social services, again, over 2,500 county residents access services, support, and programs through the Aging and Disability Resource Connection. the health centers, opening of the Gladstone Dental Clinic, and then also acquisition of property and the new Sandy Health Center, which is under construction. They'll move into demolition, I think, on July for that. And then housing and community development. As I spoke, we were awarded a new grant for youth homelessness outreach and prevention. That I think totals about 1.7 with $880,000 per year. The Clayton Moore Veterans opened 24 housing units. That's actually getting ready to close. Okay, could you roll it up? I got a chat. Okay, thank you. Just a little bit, thanks. So the Clayton Moore is actually getting ready to close. That property has moved into operation and possession by the Housing Authority. Zero suicide, universal screening for suicide risk. Let's see, 194 primary care patients have been directly asked about their thoughts of suicide, and then also from their care plans and tracking of those same individuals. On to the next slide. So here you have essentially a discussion of our budget reductions that were taken within the health centers, but across H3S. Some changes here, and what I'll do probably instead of walking through the detail is we received about a $1.2 million reduction in terms of the cut packages that Gary considered and then worked through in terms of his deliberations about what was best for the general fund health of the county. When I received those back, social services had not received a cut. And so what I decided to do was even things out a little bit, because the cuts for Children, Family, and Community Connections and the cuts for behavioral health were fairly significant. And so I spread this a little bit more evenly across the department. And so social services actually did take a cut. And that was my decision that Gary allowed me to go ahead and do. The one area where I did not smooth anything was for behavioral health, and I also did not smooth the cuts to the director's office. And then you can move on, Ed. So this will touch upon, I think, some of the questions that were submitted to us and that I have the answers for, and I'll walk through in a minute. COVID-19 current and near-term impacts. So the county is receiving CARES Act dollars and is working through that funding and where that's going to go. I have funding actually dropping into, in terms of CARES Act dollars, the health centers, CD, and then also social services through OHCS. And we are in fairly constant contact daily, I would say, in terms of this funding with the Emergency Operations Center. And I know that Gary and Elizabeth are also part of those conversations as well. And related to COVID-19, one of the things that we're looking at here is in terms of our capacity within public health to engage in appropriate contact tracing and do what we're required to do by the state. We could be looking at the acquisition, at least on a temporary basis, anywhere from 3 months to 6 months of 70 FTE to be able to do that. The majority of that will not be permanent employees, of course. These will be temps. And so we're in that process now between public health and the EOC. Longer term impacts for COVID-19. The state had gone through an exercise where it requested its departments to remove approximately, I think that exercise was 18% of their overall, but 17% cut across all departments across the state. Right now, what we've heard is the state may be projecting about an 8% cut. And so we're in the process of looking at what that's going to mean for us. But an example there is our behavioral health contract with the Oregon Health Authority. that could be a substantial issue for us as we go forward related to our ability to react and deal with behavioral health crisis as it occurs in the county. We are expecting a fairly significant increase in the request for mental health services as a result of COVID-19. I think one positive thing to talk about here is the Metro measure 26 to 10 here together. So that passed in the Metro. It did not pass in Clackamas. However, it did pass in the Metro. So I'm quite conscious of that. But this is a bulk of dollars that are going to be coming in, and we are very enthusiastic about this because this really ties into the permanent supportive housing I discussed earlier, which is keeping people housed, and that's 0 to 30% population. These are the services that are needed to help those individuals who've been experiencing long-term housing, or what I say, housing issues and houselessness, step into housing and maintain their housing. The transition from living on the street to living in a house is not easy. It is not simple. It is extremely difficult. And these dollars are going to help us help those individuals with those transitions. They're very much needed. And then below that, houselessness and mental health, I think services impacts. We don't have permanent sheltering. It could be that the Here Together dollars are going to be able to allow us some consideration of pursuit of permanent sheltering. We'll have to see. Ongoing challenges with access and capacity, as I spoke about, behavioral health. And then let's see here. Continuing challenges with accessing the state hospital for individuals under civil commitment, and then an increase in the aid and assist population, both at the jail and the state hospital, both of those being behavioral health impacts. And so with that, we will, what I can do now, Chair Parks, if you want, is I can touch upon those questions that were submitted.
Yes, if you would please, because that then we'll know what other questions that brings up. So
Sure.
I think we're doing pretty good on time. You got 8 or 10 minutes of your part of the presentation. So thank you.
Let me see if I can pick up some speed here. So with the first question, and what I'll do is I'll read the question, and then we can also submit our answers so they become part of the record. But I'll read the question so it's part of the record, and then I'll move through, I think, fairly quickly our answers. What additional cuts are thought to be likely from the state as it balances its budget in light of the $10 billion shortfall over 5 years? So I think of the areas that we're very concerned about and anticipating are early learning hub. This is our small kiddos, newborns on it, up to 5 years old, heading into kindergarten, kindergarten readiness, that program, and its partnership innovations, for healthy families. And these are all programs. We're all going to see, impacts here. Our family resource coordinators, we anticipate there'll probably be possible curtailment of the Oregon Health Plan enrollment as the state is faced with how many people can actually provide services to. So we could see the reduction of services covered, and either through direct reductions, or we may see a reordering. And I think if folks remember back to pre-ACA, the Affordable Care Act, where the state would often reorder the list of covered services as it dealt with shortfalls in the Medicaid population. Behavioral Health Division, funded by the Crisis Safety Net Services to the state. We're potentially going to be seeing, some reductions in there in terms of our capacity to provide walk-in services. So we may wind up only providing those services that are statutorily required. That would really be a travesty, because we have done an enormous amount of work to build the system we currently have. We may be looking at some reduction or elimination of peer delivered services. Again, this has been outstanding program championed by Clackamas County and actually copied by others in the state. We may be looking also at reductions in county positions. Also, intellectual developments and disabilities program, very uncertain impacts there. We finally are in a position in this year to actually hire positions that we actually need that are budgeted. This is not a general fund position. These positions are not general funded from the county general fund. They are essentially revenue from the state by formula. We may have to look at not hiring those. In terms of the Metro homelessness funding, I'll push that to just a little bit later. That was question number 3. We had a question about the Continuum of Care program. How efficiently are we running this program? Are we leveraging external opportunities for vets, National Guard, nonprofits? And there's a desire to see more innovation in this program for the community. Just really quickly, in terms of efficiency, the Continuum of Care through its funding served 554 people in the last year. Counting those who called the coordinated housing access line, what you're looking at is about $4,000 going to each person per year who are able to access services. There is a waiting list for the CHA, but 84% of those folk who were able to access and get into the Continuum of Care programs moved on to permanent housing. Through COC funding, which is about $2.7 million, we coordinate that across the entirety of the homeless system. So that 2.7 actually results in terms of leveraging of up to $8 million. So as I spoke about the leveraging, 60% of the total is in-house, and the rest of that is going outside of that 2.7 million. And then I think there, in terms of the external opportunities, one of the things I wanted to talk about was the Youth Homelessness Demonstration Project, $1.7 million in the first 2 years, and then we have an opportunity for renewable of approximately $880,000 towards houseless youth. This is the first time we've actually had directed money aimed at houseless youth. And then of the Continuum of Care, we've got 313,000, almost 314,000 that are vet-specific programming, and that sits within social services. And I think, within innovation, HUD recognized the Continuum of Care for its award for the Youth Development Project. That's 23 communities across the entirety of the county. It was not this year, but last year, I think that COC in its application to HUD scored the top score in the country. That's across all entities submitting Continuum of Care applications. The next question, Children, Family, Community Connections. In the workforce program, performance measure last year showed 73% of job seekers in county-funded programs retain employment for more than 90 days. I was wondering why the proposed percentages for FY21 was only 55% by comparison, and is this virus related? Our response, yes, this is virus related. Employment retention is highly dependent on the local economy, of course. The focus for the workforce program within CFCC is actually the harder to employ individuals, those coming out of prison, those with mental illness, those with other issues that will affect their capacity to get and retain employment. So with the number of people dropping into unemployment recently because of COVID-19, this is going to be a much more competitive environment related to employment. And so as a result, we adjusted our percentages related to that. Health centers, for the administration program budget, there's a reserve for future expenditures of almost 11 million. What is this set aside for? I couldn't find an explanation, and I'm not familiar with that program. So the health centers, in terms of their responsibilities as a federally qualified health center, what we do with them is we require, and this is in agreement with the county, and also this meets HRSA requirements of maintaining a 90-day contingency fund for health center operations. Now, some of this money has been moved out in conversation with the board, and then also with the approval of HRSA for the development of our Sandy Clinic. But we are always going to strive to maintain a fairly significant reserve for the health centers. We've got a number of very low-income individuals, and actually not even moderately income individuals now, who are relying on the health centers for their health care. Next question was dental program, percent of children to receive dental health in FY 21 was reduced to 46%. The actual was for 1920 was 64. Does this drop in anticipation have to do with the virus or some other reason? Well, actually, to be honest, and I think maybe what we should do in preparation for FY 22 is maybe have the budget committee read our stuff prior to submission. This was an error on our part. You guys are really good at picking these things out. I don't, it's in a budget this big with everything being submitted across paperwork, one or two errors. I guess I sort of expect that to happen. This was in our MFR, and essentially what this was, it was a data entry error. The actual for the dental program for FY 20 is 28.5%. Kids are actually getting kids in and getting them the dental care, getting the families to bring their children in, let alone coming in for adults, is difficult. And so we've corrected all of this, and I think our goal of 46% is correct and sustainable. It will be impacted by COVID-19 because most places have. We are continuing to do emergency dental services in the health centers, but most places have actually stopped providing dental services in terms of routine clinics. I think some of those are cleanings. I think some of those are beginning to pick up, and we're actually looking at how we're going to start that back up. Let's see, health centers. If personnel in behavioral health is reduced by 3.38% of FTE, why is personal services going to cost $366,000 and change more? So there is a slight increase in FTE for the health centers within the health centers for its behavioral health program. This was a budgeting error that was caught and corrected. So actually this increase in personnel services is due to a slight increase in personnel. Housing and community development, just curious as to where the 1.5 million decrease in local grants and revenue emanates from. It looks like there were healthier revenues from prior years and a big dip at the end of the year and moving forward. So the answer there, a budget adjustment of 1.7 million in federal housing has been recently submitted to the county budget office. There will not be a 1.5 million decrease in local grants and revenues once this budget adjustment is processed. And this is sort of reflective of the up and down relationship with HUD in terms of where dollars are and when dollars are allowed by HUD to be reflected in our budget. So we anticipate that we'll receive those monies, but sometimes it's an issue of when we're actually anticipated to receive those monies, and so we don't necessarily put them into the budget until we're sure we're going to be receiving them. And so that's been an adjustment that we made. In public health, population health strategies. Almost 2 years ago, there was an enforcement program started to keep retail sources from selling tobacco products to underage buyers. The city of Sandy was one of the first to work with the county on that program. I wondered what the results look like over the span of the program, understanding it is still new. So OHA, Oregon Health Authority, initiated enforcement of the Tobacco 21 law in January of 2018. As part of OHA enforcement efforts, only random sampling consisting of 30% of Clackamas County tobacco retailers were inspected for compliance with the law. In the most recent assessment, unfortunately, Clackamas County retailers had one of the highest rates of illegal sales to youth under the age of 21. The inspection of tobacco sales in Clackamas County revealed that 35% of sales violations were electronic e-cigarette products, which was significantly larger than the statewide average of 21.3. Over the last 2 years, public health has been we've been conducting considerable research to implement a tobacco retail licensing program. And I think we were headed towards that. And then with COVID-19. Things have been a little tabled. Public health has done a really outstanding job in this space. And so at this point, we'll pick that back up, and that'll come forward to the BCC for consideration and hopefully a vote on next steps for H3S, the county, and public health in the retail licensing space for tobacco sales to underage people. Public health environmental health program, I'm not sure what the tie is in between restaurant closures and the public health vital stats program. Can you explain this? The vital stats revenues are used to support the fee structure and environmental health program. With seasonal restaurants, events not opening, and some restaurants closing, public health predicts a decrease in revenue from fees. As a result, there's an increased reliance on vital records fees to help support the EH program. So, and this will be an issue going forward for us. And actually, we're looking at right now, because we are projecting fairly significant reduction in fees from restaurant inspections, pool inspections, and all the different work our environmental health inspectors do across the county. We are looking at actually rotating a fair number of those folk into the contact tracing program for COVID-19. So how does the passage of Metro's bond this month affect ClackCo's future programs? So it's going to take us about, and this was our experience with the Metro bond, that it's going to take Metro about 3 years to generally fully start realizing total tax receipts from 26-210. We probably anticipate that there'll be some portion of tax receipts coming in April of the business portion will probably be available April of 22. We will probably see some receipts coming in from high income earners in April of 21, and that relates to quarterly tax payments that those earners will be required to make. I don't know. We don't know what that amount is going to be at this point. So we're going to be doing community engagement work in this summer and working with partners across the county. So we're going to have to work on an IGA with Metro. And that'll be the first piece of our work. And then we're going to have to be looking at what are we going to do to be able to fund that, because actually H3S does not have the funding it's going to need to do the planning work required for 26-10. One of the things I've asked Jill Smith and Stephen Murtry of the Housing Authority to do is consider potentially a loan against those receipts. We have been informed by Metro that we can do that. And so now I've got them researching how we might actually structure something like that so we can begin to move some dollars into our planning efforts. Let's see. General question, with the state's downside revenue forecast, I think I touched upon that. That was, again, really looking at what we're thinking about in terms of state reductions. And then it says here, our narrative described a change in the way the state pays for behavioral health services, causing reductions in revenue that flow through the county. Are all of these reductions in funding being picked up by the state, or are the programs continuing in the community at the same level? Right now, there has been no reduction in programming or services. The state moved to direct contracting with the provider. This relates to our relationship with Health Share of Oregon. And so right now, as it relates to the Medicaid population for behavioral health, there is no change right now. We will be looking at maybe potential changes in later parts of FY21 as we begin to understand what the impacts to the OHP are. Let's see, how many hires have you made this fiscal year? As I spoke very early related to our FTE. Actually, our FTE is fairly flat from last year to this year in terms of actual employed. I mean, we do have our churn in terms of turnover, but we are actually working with HR to develop a report that we can actually send to Elizabeth Comfort for inclusion as relates to the overall H3S budget. How many vehicles over 10,000 are you budgeting? to purchase. We expect through social services, through its Mount Hood Express, to be purchasing several new vehicles, buses in the next year. None of those are funded through general fund. Let's see here. And then let's see, it's just the last question it is. So Community Corrections has reduced their use of the workforce program from employment services to people on supervision. Are those services being picked up another way in community corrections, or is this reduction of service to that population? The service they're losing is significant. It's elimination of a job development specialist, it's elimination of the advancement program. This was designed to work with second chance residents working in low wage positions and get them into actually career path employment. There will be a continuation of services for those on SNAP benefits through our STEP program. The STEP program provides funding for only 50% of the cost of that program. So we're utilizing much of our existing fund balance to shore that program up for the next fiscal year. That was part of the monies I moved into CFCC to help with their reductions. And then that's pretty much it. So that's the end of those formal questions, and I'll open it up to questions from the committee.
I keep forgetting I'm muted. I'm sorry. So thank you very much, Rich. Appreciate. Brenda, you'll be facilitating this, and I see at the moment we just have one hand up.
Correct.
We did have two, but one went away. Okay, so now we got another one, but all right, thank you.
Mr. Savis.
Rich, thanks for your presentation. You have a very complex array of departments with a lot of complex issues embedded in there, and I definitely respect you and your staff for all the good work you do. You did gloss over kind of one of the questions that I had asked, and it's not that big of a deal in your department, but I would like to get at least the answer in that. And the question was, how many hires? And it's not in your department because it's got very little general fund. It's not as critical, but I think I would really like to have that answer. How many new hires have you had in the last 12 months? All that said, I'm really reluctant personally, I'm very reluctant to dip my oar in the water and to tell or advise or make suggestions for cuts in your department per se, because of the complex nature more than ever between, as I expressed before, the extra workload and challenge of meeting the housing bond requirements, and now this new homeless measure, and then the COVID crisis. I mean, you all have a lot on your plate. I recognize that. I respect you all for how you are navigating and coping with that. It's got to be a tremendous challenge. So you have my appreciation and admiration for your ability to hang in there and do the job every day. All that said, however, I do want to point out that in light of the challenge we face, I think it's a general fund revenue element that is probably something that we've got to examine, and how we find and kind of salvage that. I know the policy of backfilling. I do know the history of that. I do know we have incrementally worked that general fund contribution up to what it is today. And as the administrator mentioned yesterday morning, I believe his words were, we have not had a structurally balanced budget since 2012. And I do know that it was right around 2010, 2011 when the board stepped away from its no backfill policy, and slowly those backfills became, or general fund contribution became, slowly accrued to where they are today. That said, my question is before and has been, I mean, I've always been concerned, and you heard me last year and you heard me the year before, and I'll say it again, when I see the amount of revenue, the carryover revenue that is not going towards the critical services that we all value. And we do know, and we do have needs out there, and we are affecting people's lives and saving lives and all of those things. I just want to mention that that's something that's near and dear to me. Most of my family in Oregon have been or retired from and still are, working for county government in the health and human service environment in a different county in the south part of the state. So I understand that pretty significantly. But my question to you is, how how flexible is that health center revenues and that $30 million? I know that $30 million is not all health center carryover, but we've had a significant amount of carryover, and it doesn't seem that those dollars are being applied to the tremendous need out there. And I just thought that I do know that there's been a loan out of the health center funds to another department. So obviously it must be somewhat fungible to some degree. But if that's a means of trying to ease back the general fund requirement, then that's something that I would like to pursue. How you do that, again, I don't want to put my oar in the water on that. But if you could expand on that piece of that, I'd appreciate it.
Sure. In terms of the health centers, their reserve is, there are some fairly significant restrictions on from HRSA related to those dollars in terms of what they can be spent on. The loan that was made by the health centers to, that was actually made to the housing authority related to Clayton Moore closing costs. I think that was $300,000. That's a 7-year note. That was determined to, be used, to support the, 24 units for vets. And I think basically seen as something direct related to the Medicaid population. But it's also expected to be paid back. If it's not, it has to be paid back. That's the reality. And Clayton Moore was seen as a really good project for the repayment of that. And actually that loan is also an interest loaded loan. So there's an expectation that the health centers in terms of its reserve will remain whole through that loan. So that would have to be something that when we consider the use of that reserve, the expectation of HRSA, and all of this actually goes through the Community Health Council. They have to be involved in these decisions as it relates to the health centers. All that money has to be actually paid back. I think that's probably my answer related to that. Also, to answer your question related to FTE, we participated in the filling of 88 positions over the course of this fiscal year as it relates to turnover. So that's the number that we currently have from HR.
Okay, so you covered most of it. I just want to go back and just emphasize one question that I had again, is that carryover. I would say that it's why is it that we cannot apply that to where the needs are? Are we going to have a $30 million carryover or a sizable 8-digit carryover in perpetuity?
No, I don't expect that to be. I think for the health centers, the expectation is always that they're going to maintain that 90-day reserve. And so related to their overall budget, that's always going to be a fairly large chunk of change. We are planning on, and anticipating that across the rest of the reserves held, some within behavioral health, some in social services, and then also you see some of these dollars, it's reflective of monies held by CD, community development, will be spent down in anticipation of what's happening in the state. We're always going to try hard to hold some contingency and reserve in place to be able to deal with curveballs, because we get those every single year. But for example, my office, I by and large don't have any contingency left, and so I'm going to have to, that'll be spent down by the remainder of this year. Some of those dollars going into LEAD, law enforcement assisted diversion. So we're by FY21 heading into FY22, it's going to be a little bit of a rough landing in terms of what FY22 looks like.
Okay, well, thank you for your response. I just want to state that if anyone's going to dip their oar in the water on your funding, it's probably going to be the state legislature and how the federal monies and grants come in, and
let's take it away.
Yeah, exactly. So that's why I'm really reluctant again to even suggest much of anything in your department. But obviously efficiencies and all those things we need to strive for, and meeting MFR and all those things are very valuable tools. I want to see us pursue that. It's just important, I think, that we recognize for people that are listening and so forth that, these are restricted funds, and you are virtually most of your funding comes from grants and so forth. And it is somewhat going to be a benefit to have the dollars from the 26-210 measure to help, as flexible as they are, to maybe help in a number of these areas, maybe where we have needs. So with that, thank you for your responses.
Okay.
Thank you. Ms. Caldwell?
Thank you. Hi, Rich.
Hey, Sean.
I have a concern about what I'm seeing in this budget in terms of reduced mental health services across the county. And I heard you say it's not immediate, but I'm wondering whether this Metro bond would be able to serve both your population and community corrections population. They have a contract that was cut. I know there are some different needs in those two different populations, but would this bond be able to pick up any of that service?
That's a good question. I don't know about the community corrections. I'd have to take a look at what we may be able to apply for that in terms of the permanent supportive housing. In the permanent supportive housing, those dollars are definitely can be used for the provision of mental health services. To what extent we're going to be able to do that is really related to our approach to houselessness or our approach to services for folks who are in units. So as we're bringing projects online and putting people in services, so let me take PedCorp, for example, be specific. Of those 212 units, we may have some folks who are occupying that 0 to 30 space because they're getting also maybe a voucher to be living at PedCorp. So we would look to use proceeds from 26-210 to help provide the services that individual is going to need in order to sustain their housing. Those services could be, behavioral health case management. So in that sense, we can bring some of those dollars towards that. To what level, I'm uncertain at this point. That's part of the programming and planning work that has to happen related to how we're going to do that. I wish I could be more definitive, but I just don't really know at this point. We will be looking to leverage our overlaps and get after efficiencies where we can in behavioral health, so we can bring those dollars into the behavioral health spectrum for certain individuals. So if you think about 800 units, 1,500 units, and half of that population has some sort of behavioral health issue, we would be looking to use those $26-210 to provide services to that population. So it could be substantial. And then in that sense, free up other dollars for other parts of the behavioral health system, because I reflect your concern. And so does Mary and Mary Rumbaugh, who runs the behavioral health division. This is one of those things that provokes anxiety and keeps us awake at night.
Thank you.
Commissioner Bernard?
I just want to make some comments, really. Richard, thanks for the work you do. It's amazing. And I'm excited about the two sources of revenue that'll come into your department. They're both, certainly the last one is very defined on what it can be used for. And like you said, it's going to take a while for us to actually see those revenues, as well as the housing measure. But the great thing about what we're doing in Clackamas County is that I had a fly chasing me around in here at the beach here, is that the potential for housing development is huge. We're not going to solve homelessness, but we're going to make some massive improvements. And we've been working really hard to do that. But I just want to thank you for what your departments and Mary for her advice. during the discussions on the Metro Supportive Housing Measure, because it is really going to make a big difference. Anyway, that's all I have to say. I had some other questions, but you answered them. Thank you.
I think, Chair Bernard, to add to that, actually, one of the things that I hope is not lost on, individuals watching this presentation is the fact that the Metro bond paying for units and then the $26,210 coming in, the Here Together dollars. This is actually, in many ways, economic development money. It's a massive economic development project in terms of the creation of these units and then bringing in the services on these units. If you look at the multiplier effect for the county, you're looking at probably somewhere a sustained multiplier effect somewhere. If I go just with 3 as a multiplier, you're really looking at, I think, a sustained somewhere in the $300 million a year range in terms of economic development. So the timing on this is absolutely fantastic for the county related to the impacts of COVID-19 on the economy.
Yeah, and the money wasn't there before.
It was not.
And the other thing is Clackamas County is ready for the housing portion. We have projects in Oregon City, Milwaukee, and others that we're working on around the county. So great job. Thank you.
Thank you. I appreciate it.
Commissioner Schrader.
Well, thanks, Rich, for everything that you folks do for all of us, especially during a pandemic, which none of us ever anticipated actually happened. Well, you answered one of my questions because I think Paul had asked about, you keep some money aside for things that come up. Okay, and I was going to ask specifically what you meant. You answered that one already. I'm curious if you have, sorry, I have barking dogs. I have a zapper that's supposed to stop them, but when they're too far away, it doesn't stop. It doesn't stop them from barking. So can you tell me, can we get a list of how many folks that you have under your purview that actually are revenue producing employees in terms of grants and things like that? Is that something that's?
Yes, we could do that. We could generate that for you.
That would really help us out. And then the other piece I had is, could you tell me what the criteria were for your budget reductions from the general fund? Because I'd like a list of everything. If you can get me a list of things that also get general fund money, I'd like to assess that against what you have listed here to see, if we agree with those particular priorities.
Yeah, sure. We have a full package of 5, 10, 15% across all the divisions, and we could certainly get that to you.
Okay, that would be good. That would be good. Those are just
along with those criteria, sure.
Good questions. And I want to voice one concern, okay? And I am very happy that 26-210 passed, but did not pass in our county. And that makes me sad. But my concern has always been, now this is dollars. We don't have a projection on whether or not, given the economy right now, whether it will be 250 million. I'm concerned about that because with what we've been dealing with, the folks that would be getting the taxes may not, I think there's going to be uncertainty in the amount of money coming in. That would be my read. And the other piece of this is that, do we have any plans of how we're going to do similar services at all? If we have any funding for the people of color, for diversity and equity outside of the metro boundary? Because remember, this is not covering our entire county. It's just covering a section of our county. And when I look at our demographics, a large Asian American population in Happy Valley, but most of our Hispanic farm worker population, which I've worked back very closely in the day, is largely out in those rural areas. Mm-hmm. So I guess I'm feeling as if there's, I don't know how to say this gracefully, some inequity in how that's going to happen. And I don't think it's our fault. I don't think it's your fault. I don't think it's anybody's fault, but it has set up a situation where I'm concerned that we're not going to be serving demographics out in our rural areas that really need it. So
Right.
anyway, that's just a comment. So,
Okay. Well, actually, just to touch on that, it's a little bit of a softball question. I appreciate it, which is on the
Good.
equity, diversity, and inclusion. For us, there is a framework that's required related to 26210. There was a framework required for the Metro bond. We are actually using that framework across the entire county as it relates to our equity lens. So we've been very conscientious about applying that, and we're going to be looking really hard in terms of 26210 about how we're able to leverage those dollars across the entirety of Clackamas County, not just Metro.
Okay. That's always been a big concern of mine. So I'd really like to be kept up to speed on that one. Thank you.
Yes. The inequities related to that was something that both myself and Jill Smith spoke to frequently with Metro in regards to, in particular, 26210.
Okay. Thank you.
Commissioner Fisher?
It's frozen.
Commissioner Fisher, are you?
I'm frozen. Now on mute.
You're on mute. So we'll come back to her. We'll go on to Commissioner Humberston.
Thank you. Rich, just one question. With the funds that may come from, I think you said it's 26210 is the number. Does that allow you to shift some spending that you have been spending in the metro region out to the outside area of the metro region? In other words, not using the 26210 money,
Right.
but actually funds that you've currently been using and spending in the urbanized area and shifting some of that out to the rural area.
I can't. I can't offer that with specifics, but I can give you my best educated guess, which is yes. I do think we'll be able to look at program planning that begins to move some dollars outside of the metro area in terms of services. I mean, for example, if I look at, say, LEAD, Law Enforcement Assisted Diversion, we have a contract with Central City Concern. Now, LEAD is across the entirety of the county. We may be able to bring some of those dollars that we're getting from here together and expand LEAD. So what we'd be doing then is expanding LEAD across the entirety of the county, even though we would be specifically targeting some of those $26210 towards LEAD in the metro area. Because we need the law enforcement assisted diversion across the entirety of the county. This is an issue that every single law enforcement entity, agency in the county is faced with. So that's a very specific example, and I'm pretty confident of our capacity to do that. In social services, I think we can do that as well. I see Brenda there, and I've had some folks just sitting silently for a little bit. Maybe Brenda could expand that a little bit in terms of what she anticipates SSD to be able to do.
Sure. Yeah. Thanks, Rich, and members of the committee. Yeah. The county receives state and federal dollars, local dollars too, that we can definitely use for the part of the county that falls outside of the metro boundary. A lot of our services are what we call scattered site. So we help people find apartments, throughout the county. Those efforts will continue. And that's been a discussion at the tables around Metro around there's an acknowledgement that Metro does not cover the whole county, and the county has a responsibility to serve all of our citizens. So we will be able to tap into these other funding sources to provide services to houseless folks outside of the Metro boundary.
I appreciate that, because I think I remember Rich talking about that a few months back, and I thought that there was the ability to do that. I wanted to confirm it. How about things like the health clinic in Sandy? Would it allow you to shift some funds again from the urbanized area to, say, the health clinic in Sandy to meet some needs out there?
Yeah, I think so.
Thank you very much. And I'm not expecting any numbers right now. I get that, but just knowing that we can expand into areas that have been underserved will be very helpful. Thank you.
Commissioner Fisher, did you have a question?
Yeah, I'm sorry, my computer keeps freezing, and so I'm having a hard time. Hopefully I can get my question in really fast before it freezes again. Thanks, Rich, and nice to see everyone. I am concerned, one of the budget cuts for $230,000 general fund housing for homelessness through Brenda's program, Bridges to Housing. I'm concerned that there is a requirement that funds that are dedicated to homeless services not be reduced that are currently being provided. That's a requirement of receiving Metro dollars for the 26-210. So I'm concerned that if we reduce that, we could be jeopardizing our ability to receive money this fiscal year.
Mhm. Mhm.
So Rich, I can respond to that if you'd like.
Go ahead, Brenda.
So there is a provision in the agreement that if there is an overall reduction in county general fund, then counties will be held harmless on that provision. So I think in this situation, we should be covered with that provision. And I'll just state that, you know, the general funds and social services reductions that came out of the housing programs, because that's where the money is. I was trying to be responsive to the request not to cut personnel. And if I had taken those reductions in any other programs, I would have had to cut personnel costs. So that's why the cuts for social services, for the most part, ended up in our houseless programs, because that's where the money is.
Okay, but for this fiscal year, we're not going to be seeing a reduction in general fund, I believe, because that won't hit us until later. So I just want this budget committee to be very mindful of that piece. And it concerns me about taking that reduction. And I know you have to take reductions, but I don't want it to jeopardize us later. And Jill Smith isn't part of this call right now, but we both were part of numerous meetings debating these principles and provisions. So I know how important that element of the agreement was to the coalition.
Yeah. Commissioner Schrader?
Yeah, I just want a clarification. So with the $26,210 coming into the urban areas, you'll be able to shift dollars you're already using there to the rural areas. That's what I think I heard.
We should be able to do that, yes.
Okay, so the notion that there was no shifting, because that's what I heard. So where did that come from? That you couldn't replace what you're already, the dollars with something you're already doing in an area. But you're telling me we can do that.
Yeah, Martha, can I answer that? Because I think I was part of the negotiation. We wanted to make sure that we could use, it was reductions for the entire jurisdiction. We wanted to make sure that we would be able to shift current spending from the urban areas into the rural areas. And, but that came with the not any reduction overall from what was currently being provided. So this is going to be really interesting with the reduction in state dollars, because that I think is really potentially going to come in our next budget cycle. But anyway. Yeah,
and my other concern is given the taxing methodology, I would be concerned about what the amount is. I think it was at 250, what was it, million? So given the economic collapse that we're experiencing, it'd be good to keep track of that and see what our expectations would be for those dollars. But I'm assuming then, good, that we can shift urban dollars to rural house to work with those communities out there and backfill. Because it sounds like it's a backfill, right?
Yeah, I mean, that was part of the pressure that both Jill and myself put on Metro in these conversations, that we want to be able to retain our agility to respond to the entirety of the county, because, you know, as we explained, our services don't stop at the Metro boundary. And so therefore we were going to have to be able to have some flexibility in terms of how we distributed funds.
Okay, thank you for that.
Commissioner Savas? Yeah,
this is exactly the one of the challenges I think that we all struggled with during the discussions with the concept of the housing supportive measures. And, you know, my earliest comment and concern or hope was that maybe this was actually be a statewide initiative versus a regional initiative. And that by that means we would be supplanting or apportioning more monies to an existing system for greater expansion of services as needed. And that if the legislature cut it or expanded it, then it would just build on an entire administrative system, and we wouldn't have to duplicate or create another set or another layer of administrative costs and everything. So my concern in the currently, now it's passed, now we have a new reality, a lot of upside, but an areas though of concern as far as how we administrate this and actually meet, so to speak, the legal requirements. And being that it did not have a lot of structure behind it, I still think that there's a expectation that we will be as responsible to with those dollars as we can. And I'm sure that we'll be held accountable by a lot of folks. So I think there'll be a lot of eyes on how we structure the admin element of this and how we spend the dollars and where we spend the dollars. So I think it's critical to think or be cognizant that this is not free money and we just can't divvy it out where we choose. There's going to be restrictions and parameters in which we need to abide by. And a lot of that hasn't been yet developed. So looking forward to that aspect. And that's, again, part of the reason I'm reluctant to really suggest that we put our oar in the water with everything that's going on, including the COVID thing. So that's all I have. Thank you.
Thank you. We have one more hand, Commissioner Humberston.
Yeah, I just wanted to comment that to some degree I agree with Commissioner Savas that it would have been better as a state initiative because it's a statewide problem. It's not just a localized problem. But you know, it is what it is. It is a perfect example of what we mentioned yesterday, and that is that we have these issues that are being pushed down to the county level, oftentimes without state funding, where there should be more state funding to address it as a statewide issue. Just wanted to reiterate that point. We're having that happening in social services. We're having it happen in law enforcement and criminal justice. And I suspect in other areas too, but certainly in those, and it's most notable.
With that, thank you all for your comments on that, Rich, and your staff. Thank you for your presentation and your diligence in answering all the, especially the advanced questions that folks had sent out, because I know that was a lot. So thank you so much for that.